first, so as a small business, just talk to me about what kind of an issue the rising cost of healthcare presents to you.
Well, it's a pretty big issue because it's one of the biggest benefits that we offer as a small business. And it's costly. It's also people are out of work and they can't be here. So we need insurance that allows them to get well as soon as possible. But also, I think that one of the biggest things is preventive maintenance. We don't really, very few people talk about preventive maintenance when it comes to healthcare and prevention. Health clubs, no smoking cessation things, lifestyle changes, nutrition, a lot of things that make a big difference in the bottom line of healthcare.
And if you weren't able to offer healthcare, it becomes hard to recruit good employees, right?
Yes, it does, but we do offer healthcare. We pay a portion of the employees' healthcare. It does make a big difference.
And so what do you, overall, when you're hearing some of the healthcare reform proposals coming out, what do you think?
I think the president has really good intentions, and I think some of the ideas are great, like the co-op and the nonprofit stuff. But my concern is, how are we going to pay for it all? That's probably the number one thing. It's always the federal government is really good at coming up with ideas and solutions. But when it comes down to execution and how we're going to pay for it, is the biggest concern.
And so, but in general, in terms of the concepts that have been proposed, do you like those?
Some of them, but some I do not. It's really difficult to understand exactly what the detail entails because the bills are so long and extensive. Unless you really get down to the nitty-gritty, you really don't know. Illegal aliens, are we going to be paying for illegal aliens? They say not, but until you actually read the bill, we know that for a fact.
What are some of the things that you like?
I like the aspect that employees won't be canceled with insurance for pre-existing conditions. I think that's kind of a crime in our community. But also I see, and I like the idea where doctors can get help with their malpractice insurance. I think that's going to skyrocket, which improves cost. I think there needs to be concessions on both sides of the aisle.
And so, do you feel like, as a small business, do you feel like these proposals will help to maybe reduce or contain your costs for health insurance?
Wow, that's a loaded question. I think it has the potential to reduce the cost, but unless it's managed well, there are so many things the federal government does not manage well. Unless it's managed well, the cost could be higher. Again, prevention of disease is something I think people should get credit for. Small business should get a credit or actually get paid by the federal government to offer incentives to the employees to help them with having gym memberships, having smoking cessation programs, having nutrition as a guideline on how to eat correctly, eat the best way to be healthy. I mean, these huge corporations, they can afford, these state-of-the-art gyms inside their buildings, but small companies under 100 employees, they can't do it. So if the federal government wants to decrease costs in a national insurance plan, we need to focus on prevention.
Well, I'm just going to go through some of the specific proposals that have been made. There's one that's in the current Senate bill that would require all people to have insurance, to buy insurance, or be fined. What do you think about that?
We're a free society. I don't like just from the basis of requiring somebody to have insurance if they choose not to. I think that they should be able to choose not to, but if they use the service, if they have to go to the hospital, have to go to a doctor, and somebody's going to pay for it, and the tax person is going to pay for it, then maybe they should be charged an additional tax to cover the cost of what the insurance would have normally been charged to them, plus a penalty. Maybe it's 100% penalty for using the system but not buying into the system, instead of a penalty for or charging them up front.
Okay. You mentioned co-ops. What do you think about the co-op idea?
Well, Printegration uses Optima Health, which is a nonprofit insurance, and the costs are lower than some of the other competing vendors. However, it's probably not as low as a large corporation could offer their employees. So we're still a small business, but it's difficult to have the best rates.
So you think if there were more co-op opportunities for small businesses, that might be helpful?
Well, again, we're a free enterprise country. The more competition always does a better job with price. I mean, if you look at our industry, the printing industry, prices for printing are way down than they were 20 years ago.
Okay. And what do you think about the public option?
public option, meaning that any employees can just buy from the federal government insurance plan. I think there needs some kind of option, but I'm not sure that it's going to maintain costs. It would worry me that it's people that have bigger problems with their health would kind of lean towards that plan.
Any idea how much your health insurance costs have, like, maybe gone up over the last decade or so?
On average, 10 to 20% a year.
That's significant.
Yes, that's very significant.
Yeah.
Instead of